ES Audio.
From the Evening Standard in London, I'm Mark Blunden and this is The Leader. A whole shift's worth of time. That's how long some ambulance crews report being stacked outside hospitals for as the NHS waiting times crisis deepens. Delays hit record highs and 5.8 million people across England await their treatment starting. How has it come to this? We're joined by Colm Porter, National Officer for Unison, who's responsible for 20,000 paramedics, ambulance technicians and emergency care assistants. Colm, what's the reaction from your members to these latest figures?
Unfortunately, Mark, it's something that we were expecting. I think the demand that's on the ambulance services has been coming really since the end of the last lockdown. Even during the summer, which will be traditionally a quieter time for ambulance services. At that stage, we were kind of getting reports from staff that they were experiencing levels of demand that would be in line with, winter pressures, even at that stage during the summer months, which is like a traditionally quiet time.
Just how bad is it on the front line?
Well, we were kind of in the really unfortunate position that every single one of the ambulance services across the UK are now in REAP 4, and that is the measurement by which there is demand on the service, and 4 been the highest. So that it's a case that we've actually never been in a position before where all of the services have been experiencing this level of demand simultaneously. Demand was kind of through the roof in the summer, and that was kind of the reports we were getting from ambulance staff was that, they were just, clocking on, getting into their ambulances and just going from call to call to call over a 12-hour shift. And I think what's kind of happened now is that we've seen a shift in the kind of demand that's kind of been placed on them. So again, calls in the likes of the EOC, so the control rooms where people phone 999 to, we're seeing calls getting stacked and stacked and stacked because there's simply not enough resource to get ambulances to these calls. And where the kind of the bottleneck is occurring is that we have all these queues outside of hospitals. So, ambulance staff, our paramedics, technicians, emergency care assistants, they simply can't get their patients from the back of an ambulance into A&E departments.
I imagine spending all those hours stacked outside A&E with a critically ill patient is hugely stressful for all involved.
Oh, yeah, absolutely. There is that issue that you have, people are phoning 999. They're in a situation where they need that kind of level of care but measured by the fact that they've actually been brought to A&E to receive that care. And it's exactly what you're saying there. Ambulance staff end up kind of caring for those patients in the back of ambulances. Sometimes, we have had some examples coming in from, crews arriving at a hospital in the morning with their first patient, and they're there for their entire shift and they finish late as well. So, there have been examples of people just waiting there for the entirety of their shift. And, if you're a patient in a poorly state, that's very distressing for you. And ambulance staff are doing an absolutely amazing job to try and manage that situation and give the best possible care they can. As these ambulance resources are no longer available, we have staff who are working in these control rooms under immense pressure as well, because they're still receiving more and more calls. They're having to stack calls. They're having to have difficult conversations with people who are in some cases desperate to receive an ambulance.
What are the risk levels going into winter?
The government kind of really does need to kind of act and try and get more resources into A&E to allow people to access the care that they need. Winter is on its way. It hasn't quite arrived, but the level of demand that's on all NHS services at the minute are at winter levels. So, if you kind of look at it from that kind of perspective, it's not going to take a whole lot to kind of tip it over the edge, really. Some action does need to be taken to try and, improve that flow through hospitals.
And finally, how would you say paramedics' jobs have changed since the emergence of COVID?
It's just like kind of everything's kind of changed for them. It's almost hard to remember what, you know, life for these people were like before COVID. I mean, from the outset, their perception of being safe going to work has diminished in some ways. I mean, we saw it from the whole PPE fiasco from the outset, that ambulance staff were kind of going in to see, you know, COVID patients. They didn't have the correct PPE, putting themselves in harm's way. So from that kind of perspective, I think it's kind of changed as well. Just the constant demand. I mean, as I kind of said, like, demand on the ambulance service for a number of years has been through the roof. But it's kind of gone to a whole new level. In the height of the COVID crisis, you know, it was just simply ambulance staff going from COVID patient to COVID patient to COVID patient who were in, you know, very kind of poor condition. It's changed fundamentally, really.
There's more on this story in the Evening Standard newspaper and at standard.co.uk. That's The Leader. We're back tomorrow at 4 p.m.